हेलो दोस्तों, वेलकम बैक टू आवर चैनल नर्स अड्डा। तो आज हम डिस्कस करने वाले हैं मेडिकल सर्जिकल नर्सिंग, जो कि है एक मेन सब्जेक्ट कोई भी नर्सिंग एग्ज़ाम या मेडिकल फील्ड के लिए। ओके, तो आज हम मेडिकल सर्जिकल नर्सिंग का ही एक इम्पोर्टेंट सा टॉपिक पेरी ऑपरेटिव नर्सिंग डिस्कस करेंगे। तो बिना टाइम गवाए शुरू करते हैं हमारा फर्स्ट क्वेश्चन। Which instrument is commonly used to cut sutures? Your correct answer is option B, Mayo scissors. Which instrument is used to grasp the skin during surgery? Your correct answer is option C, tissue forceps. Which suture is non-absorbable? Your correct answer is option D, silk. Which member is responsible for opening sterile packs and documenting the procedure? Your correct answer is option C, circulating nurse. Which postoperative complication is characterized by separation of wound edges? Your correct answer is option C, dehiscence. The purpose of preoperative fasting is to prevent. Your correct answer is option C, aspiration during anesthesia. The preoperative period begins. Your correct answer is option C, when the decision for surgery is made. Informed consent should be obtained. Your correct answer is option B, before pre-medication. Who is legally responsible for obtaining informed consent? Your correct answer is option C, surgeon or authorized physician. Which surgical team member maintains the sterile field and passes sterile instruments? Your correct answer is option B, scrub nurse. The circulating nurse is considered. Your correct answer is option C, non-sterile. Which principle of surgical asepsis is correct? Your correct answer is option B, sterile touches sterile only. Which solution is most commonly used for surgical hand antisepsis? Your correct answer is option B, chlorhexidine or povidone iodine. Which instrument is commonly used to hold a surgical needle? Your correct answer is option C, needle holder or BP handle. Which position is commonly used for abdominal surgery? Your correct answer is option C, supine position. The surgical position commonly used for vaginal and gynecological surgeries is. Your correct answer is option C, lithotomy position. Which surgical position is commonly used for kidney surgery? Your correct answer is option B, lateral position. The primary purpose of the surgical timeout is to. Your correct answer is option B. Confirm the correct patient, procedure and surgical site. Next one. Which organization developed the surgical safety checklist? Your correct answer is option B. WHO. The sign-in phase of the WHO surgical safety checklist is performed. Your correct answer is option A. Before induction of anesthesia. Surgical hand scrub aims to. Your correct answer is option C. Reduce transient microorganisms and decrease resident flora. Which item is considered sterile? The correct option is option B. Center of a properly prepared sterile field. Which instrument is used to clamp blood vessels? Your correct answer is option A. Artery forceps or hemostat. Which instrument is used to separate the edges of a wound? Your correct answer is option A. Retractor. Which suture material is absorbable? Your correct answer is option C. Vicryl. This suture material is non-absorbable. Your correct answer is option D. Nylon. Which post-operative complication is most commonly prevented by deep breathing and coughing exercise? Your correct answer is option B. Atelectasis. Which post-operative complication is most commonly associated with prolonged bed rest? Your correct answer is option B. Deep vein thrombosis or DVT. The first priority in the post-anesthesia care unit or PACU is. The correct answer is option B. Airway maintenance. Which postoperative finding should be reported immediately? Your correct answer is option C. Bright red bleeding soaking the dressing. The sign-out phase of the WHO surgical safety checklist is performed. Your correct answer is before the patient leaves the operating room. Which complication is most likely if surgical instruments or sponges are not counted correctly? The correct answer is option B. Retained surgical item. The scrub nurse is primarily responsible for. Your correct answer is option B. Maintaining the sterile field. Which nurse documents the surgical procedure and obtains additional supplies during surgery? Your correct answer is option B. Circulating nurse. The most appropriate action if a sterile glove becomes torn during surgery is 2. Your correct answer is option C. Change the glove immediately using sterile technique. Which microorganism is the most common cause of surgical site infection or SSI? Your correct answer is option A. Staphylococcus aureus. The most effective measure to prevent surgical site infection is. Your correct answer is option B. Strict aseptic technique. Which action by the nurse breaks the sterile field? Your correct answer is option C. Reaching over the sterile field. Which color of biohazard bag is commonly used for contaminated infectious waste in India? Your correct answer is option B. Yellow bin. Which instrument is commonly used to hold a sterile sponge during skin preparation? Your correct answer is option B. Sponge holding forceps. Which postoperative assessment should receive the highest priority? Your correct answer is option B. Airway and breathing. Following general anesthesia, the patient should initially be placed in which position if unconscious and without spinal precautions? The correct answer is option C. Side lying or lateral recovery position. Which sign is an early indicator of hypovolemic shock after surgery? Your correct answer is option B. Tachycardia. Which finding indicates that postoperative pain management is effective? Your correct option is option B. Patient reports pain relief and is able to deep breathe and cough. Which patient has the highest risk of developing a surgical site infection? Your correct answer is option B. Patient with uncontrolled diabetes undergoing abdominal surgery. Which patient is at the highest risk of developing DVT or deep vein thrombosis after surgery? Your correct answer is option B. Patient on prolonged bed rest after hip surgery. The most effective method to prevent post-operative DVT is. Your correct answer is option B. Early ambulation. Which intervention helps to prevent post-operative atelectasis? Your correct answer is option B. Incentive spirometry. Which patient should be identified using at least 2 identifiers before surgery? Your correct answer is option C, every patient. Before transferring a patient to the operating room, the nurse should first verify. Your correct answer is option B, informed consent and patient identity. Which finding requires immediate reporting in the post-operative period? Your correct answer is option B, urine output of 10 ml per hour. A patient develops sudden shortness of breath and chest pain after surgery. The nurse should suspect what? Your correct answer is option B, pulmonary embolism. The most important nursing action immediately after receiving a post-op patient is to. Your correct answer is option B, assess airway, breathing and circulation. Which sterile technique is correct while opening a sterile package? The correct answer is option C, open the flap farthest from you first. This statement about sterile field is correct? Your correct answer is option A, a wet sterile field is considered contaminated. The primary purpose of instrument and sponge count is to. Your correct answer is option B, prevent retention of foreign object. Which member of the surgical team is responsible for administering anesthesia? Your correct answer is option C, anesthesiologist or anesthetist. The best indicator of adequate tissue perfusion in the post-op patient is. The correct answer is option B, urine output more than or equal to 30 ml per hour. Which electrolyte imbalance is commonly associated with prolonged NG suction after surgery? The correct answer is option B, hypokalemia. Which postoperative intervention is most effective in preventing both atelectasis and pneumonia? The correct answer is option B, deep breathing, coughing exercise and early ambulation. To be continued in next part.